Hi, this is Dr. Willenbring from Vision Point Eye Center, and I want to talk to you today about your macular pigment optical density, or your MPOD, okay? What is an MPOD? MPOD is a measurement of the pigment density or the pigment thickness in the back of the eye in your macular area. Our macula is what's responsible for our central vision, and it's also what we like to monitor for age-related macular degeneration. Who should we be doing an MPOD score on? Ideally, all adults should have their macular pigment score tested on a yearly basis. However, there are some that are at higher risk. If you are light-skinned, light-eyed, female, and over 50, you tend to have a higher risk of developing macular degeneration. If you are a smoker or have a known family history of macular degeneration, that also puts you in the high risk. When should a macular pigment score be tested? We usually like to check your macular pigment score at your annual exam if you fall into that high risk category. However, we do occasionally test more frequently depending on what your previous scores were. Why should we do our macular pigment testing? Well, a low MPOD score has been associated with an increased risk of macular degeneration. A higher MPOD score typically indicates healthier vision, better acuity, better contrast sensitivity, and I always tell my patients the denser the pigment in the back of the eye, the more protection you have. Similar to like sunglasses. It's like an internal pair of sunglasses, or I often say it's like when you put sunscreen on to protect your skin, we're doing the same thing by increasing those pigments in the back of the eye. So how do you get your pigment tested? So our macular pigment optical density screener is a quick test that we do. It takes about 2 to 3 minutes and is non-invasive. And the great news, it gives us a score right away. What do we do once we find that macular pigment score? What we tell people is if your macular pigment density is low, we typically recommend supplementing. If you have a borderline or high pigment score, we still encourage all of our patients to eat a diet that's rich in zeaxanthin and lutein. Those are things that are full of dark green leafy vegetables and brightly colored fruits and vegetables. We also talk to patients about making sure that they're wearing sunglasses when they're outside. And then when you're indoors on computers, screens, tablets, or phones, we highly recommend a blue light filter in your glasses. If you have any additional questions, feel free to reach out. Thank you.